And part of our story starts at a rural hospital in Namatete in Malawi. And this particular clinic served about 250,000 people. Those people were spread 100 miles in every direction. So you literally had patients who were walking 60, 80 miles to access care. They were met by 2 doctors. This actually isn't such an unusual patient-physician ratio. You have more doctors in Manchester, England, more Malawian doctors in Manchester, England than in all of Malawi. So 2 to 250,000. And like a lot of clinics and a lot of NGOs, they tried to decentralize care. And they turned to volunteers. So these were subsistence farmers, retired school teachers, basically members of these remote communities who were going to help shift care from the clinic to the communities. And I was at the hospital for 8 weeks. I was told there were 500 of these community health workers. And I was there for 8 weeks and only met one of them. He's in the middle of this picture. His name's Dixon. And Dixon was walking about 40 miles every 5 days to hand deliver paper reports so that the nurse could sign off on his volunteer work and they could check in on the HIV patients. So it was clear that these health workers were just as disconnected as the patients were. And I have 2 mics. But it was also clear that there were tools that could help. So I actually met a guy who was living out of a van on the edge of the Stanford campus, and he was creating this open source software that basically ran on a laptop or a desktop. You could plug in a USB modem or tether a mobile phone by USB with a local SIM card, and that gave you a text messaging hub to coordinate large amounts of incoming and outgoing text messages. And that was exactly what we needed. So I got a couple $1,000 from Stanford. I got a plane ticket, 100 phones at $10 each, smiled at the customs officers on the way back to the clinic, and went through text message training with the community health workers. And all of a sudden we had these remote health staff who were connected to the central clinic, and saw some really amazing things happen. For the first time ever, there was localized emergency care. And over the first 6 months, 150 patients received care who wouldn't have been seen otherwise. We also saw the HIV team, tuberculosis team, and home-based care teams shift their patient tracking to SMS and away from motorcycles. They saved time and money. We saw them innovate on top of the system, so they were now managing their network, calling training sessions, really simple stuff. And maybe the most exciting use case, and this they did all by themselves. I was in Palo Alto. They started to track TB cases and do active symptom monitoring in these remote communities, and actually double the number of patients that they were treating for TB.
So this work that we're doing relies on a lot of infrastructure that's already in place all over the African continent. You have basic computers, desktops, and laptops. You have mobile phones that cost as little as a few dollars. There are mobile phone towers and companies that service those towers and manage relationships with clients. The presence of all this technology just growing explosively is really incredible. I mean, we have mobile phone subscriptions growing faster in Africa than in any other part of the world. And to kind of underscore that, I'd like to share some data from a study that was published just last July by a few prominent development economists. And they decided to look at the relationship between technology penetration and per capita income in European and African countries. And so they took per capita income data from 2002, but then they had this crazy idea. They said, let's look at technology penetration before the Industrial Revolution, before colonialism, before slavery, before we had even formalized this body of theories that we now call capitalism. They looked at technology penetration in the year 1500 AD, and you see a measure of that on this horizontal axis. And then on the vertical axis, it's a measure of per capita income. And you see a pretty significant correlation once they adjust for the migrations of peoples in the last 500 years. What does that mean? Does it mean this whole economic development thing isn't working? Well, actually, it's not that grim. We don't really know what it means that technology penetration is such a good corollary with per capita income over such a massively extended period of time. So you can speculate about it. People say that once you get some technology in place, you can use that technology to develop new ones. So if you have, steam engines, and you have horse-drawn carriages, then it's easier to think about wheels on a steam engine, and that's a train. And then you can move freight. It's the kind of standing on the shoulders of giants theory of technology development. There's something completely different happening just in the last few years all over the world. In this graph, we have on the vertical axis millions of mobile phone subscribers, or just phone subscribers generally in Africa. And on the horizontal axis, we have time. And this yellow line that's on the bottom is landline subscriptions for landline phones. And it's the previous big technology. The green line is mobile subscriptions. You could see that landlines never took off in Africa. They probably never will. And for some reason, we were able to have this leapfrogging effect. So instead of waiting to stand on the shoulders of giants, we've seen leapfrogging. There are so many other technologies that seem powerful and compelling and just cool that haven't been able to leapfrog on the African continent. We don't understand why. We think that, Josh and I think that there's something special about the social circumstances that revolve around mobile phones. So to give you a little snapshot of that, I want to tell you a little about 3 common mobile phones. This one on the right is made in China, sells for as little as $13 or $15 in Malawi. And the local population calls it the Mose Walelu. Now what that means literally in Chichewa is the Moses of today. Little historical background for any of you who might need it. They're literally referring to a man who lifted the Jews out of the yoke of poverty and oppression and took them to the promised land. They're not quite saying that this technology is a modern Messiah, but it's a lot like that. Of course, in the kind of upper class, they would call that a married man phone. Because once you're married, you don't need to attract beautiful young women, and so you don't need a cool, sexy thing. You can just, have something that won't make your wife jealous. On the far side over here, close to Josh, we have a low-end Nokia. Something I've found is that in a lot of ways, mobile phones are playing the social role that cars have played in American society. And so here you have a Model T, and it's the first common man's phone. On the far side, this Nokia, it's low cost, and a lot of people have it, but not everyone has it. The people who have Mose Walelus, they aspire to have a Nokia. It's kind of like a Volkswagen. And then in the middle, you have what is like a Ferrari. It's what you aspire to. It has Bluetooth. It can have really cool ringtones. You can take pictures, and they're crappy pictures, but you can take them, and you can sort of recognize people on the little screen. You can download applications. And so there's something that confers real power, the power of mobility. It's something that's in some form available to the common man, but then there's a form that is so much sexier than what's available to the common man. And it's kind of creating this really cool social environment. You see it all over the place, even in church. People do not turn off their ringtones, because it's just too cool to have people hear that you have a phone. You see this gentleman in the black shirt with the white stripes. He's holding his own phone and helping someone else, because when we train health workers, usually if they're kind of subsistence farmers, volunteers, less than half of them have used a phone before. The ones who have used the phones before are way better trainers than we are, because they become rock stars. Oh yeah, I know how to use a phone. You want to borrow my Mose? Sure. We see this interest in mobile phones really comes into play in our projects. We had one project managing pharmaceutical logistics. So the idea is basically you have satellite clinics with a mobile phone entering data about their stocks. When stocks are in low, they send a report to a central location, and that location sends a truck or whatever. We used a tool called Frontline Forms. So it's one of the nicer Java-enabled phones. It's a small application that creates an interface where you can enter your data, and the application compresses that data as a text message or a series of text messages and sends it to a central location. The first time we trained people to use this, gave out a bunch of phones to health workers in southern Malawi, and within 2 days, 2 or 3 days, it was a long weekend, 2 of them came back and they said, "Oh, I deleted the application. Can you reinstall it?" And we said, what? You just deleted it? Well, yeah, I pressed delete, and when it said confirm delete, I pressed that too. And we said, okay, what's really going on here? We had known for a long time that people charge their phones in kind of community charging stations because most Malawians don't have electricity in the home. And it's usually a car battery rigged up to a surge protector or a few surge protectors, and you pay 50 kwacha or 30 cents to charge your phone. Now, what had actually been happening, we eventually found out, is that they were taking their phones to market and leaving them with the charging station, then going to buy groceries, and everybody zoomed in and started tinkering. Because these are the cool phones, and everybody wanted to learn about them. We haven't played with Java applications before. What is the hospital doing with these phones? They were so cool. And so it's an environment that's developing where people like phones, and they like talking with people about phones, and they like people who work with phones, and they're creating an environment where people want to tinker, and that's socially promoted. It's the kind of, if you want to promote technology, kiss a geek environment. It's driving a lot of innovation in Africa. They're building tools that are changing Africa and already starting to change the rest of the world.
So a lot of what we're doing is meeting people where they are. Looking at how we can deliver essential services on top of existing infrastructure. And I'm going to fly through this story really quickly. After the earthquake in Haiti, there was no 911 system or anything like it. And we knew that 1% of the population was online, 1% of the population had access to landline, but fully 70% had a mobile phone or access to it. And so if we were going to interact with people's urgent needs, it was going to be through GSM network, it was going to be mobile, and it was going to be SMS. So reach out through Twitter. This is my Twitter story, by the way, if you're not all converted just yet. Reach out through Twitter. 2 minutes later, I was connected with a mobile operator in Haiti. 10 minutes after that, we had a short code, 4636, that we could use to essentially set up a makeshift emergency system. Crazy fonts. We all piled into a Skype chat, hundreds of people across organizations across 4 continents, and ended up setting up a system that processed close to 80,000 text messages over the first 6 weeks after the earthquake. And the text messages looked like this. They were Haitian Creole, free form, with vague references to location. And in order to process that, we recruited about 2,500 people from all over the world. These are Haitian Creole volunteers, Haitian Creole speaking volunteers, who translated, categorized, and mapped every single one of those messages. And the results really, they varied by use. So we had an IDP camp of about 2,500 people who texted in that they urgently needed food and water. Red Cross went out and verified those reports, and then the next day included that camp in their logistics routes. We also had really personal stories. So we had a woman who texted in, a woman who was bleeding out during labor, and a bystander texted in, and one of the volunteers who happened to be online that minute was from that exact location and had the latitude and longitude pegged to 5 decimal points. And the Red Cross was responding in 10 minutes. So that was an example of us taking something really simple, sending an SMS from one place to another, and really scaling it and using it geared towards essential service delivery. But we're also pushing technology itself in different directions. We're working on OpenMRS, which is an open source medical record system. We're building our own medical record system called PatientView, which is really lightweight. You don't need the internet to use it. We're also doing slightly crazier things. We linked up with Dr. Ozcan's group out of UCLA, and they've essentially hacked a $10 camera phone add-on to do intracellular imaging. So you can slide a blood sample into the back of the phone, shine an LED on that sample, transmit that image by MMS, and within our software, we'll run a very simple algorithm that'll compare the incoming image to a cell library and shoot back a diagnosis. So it's auto-diagnosis of malaria, certain STDs, complete blood cell counts, maybe HIV and TB. So sounds crazy, but it's actually quite appropriate as camera phones and MMS roll out.
So you've probably all heard the adage that you shouldn't give a man a fish, you should give him a second-hand commercial fishing boat so that he can teach himself long-line industrial fish capture. Actually, the old wisdom says, don't give a man a fish, give him a fishing pole and teach him to fish so he can take his destiny into his own hands. So appropriate technology is all about the simplest, most familiar tool you can find that will help someone, and then you focus on knowledge transfer so that they can take their future into their own hands.